and I'm from New York, and I'm pretty jealous of the sun and weather you guys have here. So I'm going to open up with a quick fun fact. Get this working. So we are actually not that much smarter than your average chimpanzee, right? Human intelligence, since we've been around, has really been roughly in the same band. And even with that fact, we've been able to accomplish so many amazing things, from putting a man on the moon, to building the internet, to now probably our most important creation is creating another intelligence. And this intelligence that we've created has been doubling, right? Growing, unlike ours, which has been stagnant, in a matter of months and years. Most of us will probably agree today that ChatGPT is smarter than us in almost every single topic. And we can only imagine what an intelligence that is more capable than us will be able to do. Now, when we go to the doctor's office or we try to get healthcare, we really expect them to be in this top 5 or 10% of intelligence, and maybe top 50th percentile if they're from Stanford. We want our doctors to be smarter than Einstein or Newton or Da Vinci, and they want that too, right? They want to give you the best care possible. But here's the problem, right? Your expectations just don't match reality. Your doctor went to school with a textbook this thick that they probably know inside and out 10, 20 years ago, maybe 30 years ago, and they're trying to keep up to date. But every 73 days, medical knowledge doubles. And do you really think anyone can keep up with this, right? You'd have to be reading 24/7 to do that. And it's not just your doctor's problem. It is also your fault, right? You're going to dozens of doctors getting hundreds of tests, not even including all the other stuff that we're talking about. Your data starts before you're even born. This is how much data you have by the time you're 10 years old. This book is how much gets added to that by the time you turn 40. And then this gets added on top after age 65. I mean, how many of you are doctors that have worked with paper charts in the past? You would probably agree that a patient that's been in and out of the ICU a number of times would have a chart thicker than this.
5 of them.
5 of them, exactly. And we expect our doctors, who are maybe a little bit smarter than us, or much smarter than us, to be this literal supercomputer and process all of this medical data seamlessly, and take all this knowledge, and take all of this data, and apply their intelligence on top, and do it in this 15-minute visit, right? How is that even possible, right? Who can even imagine that being capable? We have to give our doctors a break. The reality just does not match our expectations. Quick background on myself in terms of how I got involved in all this. So during COVID, a family member of mine got very sick, and so I started helping out in, both my parents are doctors, and I started helping out in their practice. They were working every day during COVID, putting their lives at risk when there was no treatment options available, and their passion was instilled in me. And so being an AI engineer, I found myself in this swamp of data and information, and I solved the problem in the only way that I really knew how, which was just to throw more AI at the problem. So what I'm going to show you here is a culmination of 100 clinicians that have contributed to this product, 5 years, hundreds of versions and modifications, and over 10 million AIs that we've created, all to help over 100,000 New Yorkers over the last couple of years keep healthier. So, next slide. So just like your pilot has this co-pilot that helps them navigate and land in foggy weather, our doctors should also get a co-pilot to really help them navigate through this swamp. Our AI co-pilot intersects all of the information for each patient, along with all of the knowledge and information out there, and applies from multiple specialist perspectives on top. Simplifies all of this into one page of recommendations, things that we really should be doing to stay healthy, just to live longer, increase our health spans. We've all been talking about precision medicine and personalized healthcare for a long time, and I'm happy to say that because of this, we've been able to make it a reality. So, I know we're not going to be stopping here, right? We're now able to meaningfully connect vast amounts of data across every single spectrum: smartwatches, food purchases, genetics, and actually leverage that for your health. I'm sure you can imagine what power this could have. Finally, I'd like to thank Dr. Shah to kind of give me all the guidance and insights to get me here, and being the generous human that he is, he recommended that I give everyone a parting gift. And so here is that gift. Each one of you today can sign up and be the first on our wait list to try out this co-pilot for your health, right? Where this AI bot will go out and look at all your information, give you all of that, all the information that you could want. And I'm excited for you to try it out. I think you guys are gonna love it. And please sign up on that link. Please be a bit patient as we have to create an AI just for you. So it might take a little bit of time. And with that, I'm all done. So yeah, thank you.
They're asking for your QR code again.
Oh, I don't know how it disappeared. We might need you to look at the screen again. Oh, there we go. Sorry.
How does it work?
Yeah, great question. So we go out and grab medical records based on your demographics and your information. We tap all of the hospitals, clinics, pharmacies, insurance companies, and aggregate all of that. Then we create AI specialists that are basically tuned LLMs, augmented with research and guidelines from each perspective based on the conditions that you have, to kind of work together in this virtual room to kind of create a checklist of things that we need to get done for our health, basically. And then we show that to the doctor, we create a version of it for you, for the patient, and put it all behind a bot as well that you can ask questions of and ask.
We would clap if we're outside.
Yes.
How are you dealing with confidentiality and privacy issues?
Yeah, that's a very, very good question. So as part of this, it's through a patient treatment agreement with a medical provider. So you would basically become a patient of the practice. So the way it works is, every doctor technically can grab all this data if they would like to. The problem is nobody does because it's way too much information to be useful, right? So we use the same technology and the same capabilities, but use AI on top to be able to do that and then legally do that in a compliant way.
The security of the data, how do you deal with it?
Yeah, that's another very good question. So we have agreements with OpenAI, Google, Anthropic, all of the underlying foundation models that we use to have HIPAA compliance and basically make sure they don't train on the data, they don't store the data, they can't look at it. It's all kept with you, basically. Yeah.
Well, this is really fascinating. How do you deal with the so-called hallucinations or confabulations that are well known in AI? And how do you deal with the kind of very rapid changes in what's needed for prompt engineering to stay on top of the latest things already built into the system?
Yeah, amazing question. So the way technology has moved with the newer models coming out, you're seeing new capabilities called tool usage, where models can actually utilize sources of data, right? So whether that be grounding information, where they can cite their sources and ground themselves in objective truth, which is, for example, the way that we build this is it's grounded in your medical data. So this way it knows, and it's actually has to verify the information. And then with regards to the external data that we use for evidence-based research and guidelines, our clinical team prepares, collects all the research and puts it in a similar kind of database or data store where the models can look at it and kind of reference and pull the information when they need it. Yeah.
Thank you so much. There is, to me, it seems like there is a bit of possible tension between something like this being a co-pilot for a physician versus at the hands of an individual person or patient. And how do you balance this not becoming, Dr. Google and then people saying, but my AI is saying this, how can you tell me something different?
Yeah, that's an amazing question. And this is something that we've really seen firsthand with giving this to patients. Most patients are walking into a medical visit without knowledge, right? They're not really seeing, what is the doctor likely to do? Why should I be going back? What is next in my care? What are the risks that I have? What we've seen is that when patients become more educated, they're able to kind of work together and collaborate on their care a lot better And so clinicians want to give that good quality care, right? But quite often these gaps get missed, not intentionally, it's just because it was never surfaced to the right person in the right time. So when patients themselves understand a bit more, if you tell a patient that your A1C is so high you're gonna go blind, they're probably gonna do something about it, right? But quite often we forget little bits of information like that. And so it leads to gaps, basically.
Is there any case law to suggest that you might have to worry about malpractice?
Yeah, that's a great question. And so the key point there is the AI is never practicing medicine, right? The AI is never actually diagnosing you. It's never actually prescribing you. It's never ordering any tests. It's just recommending to a clinician to do those activities. So same as clinical guidelines exist that a clinician might pull up in front of a patient visit, it's the same idea of this. It's just a much smarter, much more personalized guidance system rather than general population health metrics. You have personalized metrics and personalized recommendations for each person, basically.
Thank you very much.
Awesome.